Hi everybody, Dr. Michael Horowitz, owner of Vancouver Orthotics, here today to talk to you about 5 ways on how to get rid of your foot pain right now, immediately. A lot of our patients are coming into the office and they've got foot pain, and it may be the heel or the arch or the ball of the foot or the top of the foot, and there's many different causes or reasons for why a person might be experiencing foot pain. But the first thing people want to know is, how can I get rid of this and immediately? So I've made a list of 5 ways to help you get rid of this pain while you're waiting for more specific treatment. So as the owner of Vancouver Orthotics, my job is to diagnose and treat foot-related issues. And while patients are waiting for treatment such as custom orthotic inserts, here are some tips that I'd like you to pay attention to. First off, if you're in pain, if you're feeling pain and discomfort, you need to rest that foot. You need to get off of that foot, which means stop running on it, stop jumping on it, stop physically doing physical activity with it, because it's only going to trigger and aggravate this issue. Now, the problem is you might be going to work and you might be on your feet 6 or 8 or 10 or 12 hours a day. And that's a problem, because standing all day or walking 10,000 steps or more a day is going to trigger this issue. And sometimes from an occupational standpoint, you really have no choice. Nonetheless, when you can, rest this foot and stay off of it. Second way to get out of pain now is to ice your foot. Now, you can take an ice pack or a bag of peas, or what I find to be the most effective and efficient way is take a bucket, fill it with cold water, and then put one or both of your feet into that bucket of water for somewhere between 5 and 10 minutes in, and then take it out for 5 to 10 minutes, back in, 5 to 10 minutes, and back out. You can repeat that 2 to 3 times. The cold water will help reduce the inflammation around the muscles and around the joints of those feet of yours. It'll help calm them down, reduce the inflammation, and should give you some relief of pain. If you don't happen to have a bucket, you can sit by the side of your bathtub and you can put your foot or your feet into that bathtub while you're running the cold water. Okay? So the first way is to rest your foot. The second way is to ice your foot or to use cold water. The third way is to roll your foot, right? So one way you can do that is you can use a tennis ball or a lacrosse ball. I like a tennis ball because it's soft and squishy. And what you're going to do is, with your shoes off and with your socks off at the end of the day, or when you have a chance, roll the bottom of your foot on that ball. And find those spots of your foot or your feet that are most uncomfortable, like your heel or your arch or the ball of your foot. And what you want to do is you want to feel some of that sensitivity, but you don't want to dig too hard because you don't want to irritate it, but you do want to massage it. The purpose of rolling your foot with a tennis ball is to stimulate blood flow and reduce tension in the fascia as well as the muscles of your feet. All right, go to a dollar store and you'll get 4 of these for $1 or so. The fourth way to take pressure away and take pain away from your foot or your feet is to stretch it. Now, you can do this a few ways. You can stand up against a wall, lean towards that wall with your back foot on the ground, keep the heel on the ground, and you'll feel a nice stretch in your ankle, in your calf, and in the back of your hamstring. Another way to do this stretch is while sitting, straighten your leg, take a towel or not an elastic, but a towel of some sort, and then gently pull your foot towards you while your knee is straight, while your leg is straight. And that'll be a really good stretch for the hamstrings, for the calf muscle, and for the muscles on the bottom of the foot and the arch. Okay. The fifth way is to massage your foot. Now, you can do that with your own hands. You can also, if you have some form of a handheld massager, what we have at our office is what's called the Hycroft, and it provides direct pressure to the bottom of the foot. We use this in the most gentle way possible to help reduce pressure points and to stimulate blood flow. Remember, reducing inflammation and stimulating blood flow is a great way to help relax the feet and allow the feet to heal and allow the pain to subside. All right. So we talked about resting your feet. We talked about icing your feet or putting your feet into a cold foot bath. We talked about rolling your foot with a tennis ball or a foot massager. We talked about stretching your feet and the muscles of your legs. And we've talked about massaging your feet either with your hands or with a vibrational tool. And as well, I wanted to mention that if you had Voltaren or a product like BioFreeze, that's a cooling gel that you can use on the bottom of your foot just to massage that in. If you've seen your family doctor, you can get a prescription ointment as well to help reduce the inflammation on the bottom of the foot. But these are all the 5 components on how to get rid of foot pain now, as soon as possible. I know how debilitating foot pain and foot fatigue can be. We see so many patients coming in here complaining of these symptoms. Sometimes it's from activity like running, jogging, or sports, but often it's just because of going to work, standing all day, feeling the pain and discomfort of being on your feet all day, which is not easy. And then here in society, we're encouraged to move, and we're encouraged to take 10,000 steps a day or more. And the dilemma with that is that when you have foot pain and you move with that much pressure through your feet, it can lead to an aggravation of your symptoms. And since not all foot pain is created equally, I wanted to remind you the importance of having your feet properly assessed. And here at Vancouver Orthotics, that's what we do. We take patients through a 3D foot exam, an electronic gait scan exam, and do a variety of other orthopedic tests to determine what is the source of the pain. Not all pain is created equal, and we do want to know what's causing this pain. Once we come up with a diagnosis, we can then come up with a game plan. And a game plan involves treatment, not just the home treatment that I've recommended here, but the type of treatment that we can do to you or for you to help your feet heal and improve. Each foot's made up of 26 bones, and it's so important that you have balance, stability, shock absorption, and alignment. And one of the ways to get good alignment with your feet is to have a pair of custom orthotic inserts made to fit into your favorite shoes. And that can go into running shoes, I can go into dress shoes, work shoes, high heels, even ice skates, rollerblades, ski boots, and so on. It's so important to have a good pair of shoes, a pair of shoes that has stability in the ball of the foot as well as stability in the heel. So I do have lots of opinions on what a great pair of shoes could be for you. But again, it's really helpful for me to meet you, to do a consultation, to diagnose where your foot pain is coming from, and then to come up with the appropriate recommendation. Sometimes orthotics are not the answer, but sometimes it is something like massage, acupuncture, physiotherapy, or other hands-on types of treatment. So I wanted to create this video because so many people are complaining and looking for how can they help themselves ASAP. And I hope this video has been helpful to you. My name is Dr. Michael Horowitz, the owner of Vancouver Orthotics. Please visit our website at vancouverorthotics.ca. Lots of great information there. Lots of great information on our YouTube channel. So please subscribe to the YouTube channel and enjoy all the videos you see. If you have any questions, you can email us at info@vancouverorthotics.ca. You can call us at 604-737-3668. Happy to answer any questions you may have. And through our website, you may also book an appointment online. So nice and convenient, and happy to do anything we can to help you and support your feet and the rest of your body. Thanks a lot, everybody. Have a great day, and we'll see you on our next video. Bye for now.